if we look at the supply chain part, our colleagues have already mentioned lots of things, but I can maybe add just one more issue, since I'm looking after the our group's supply chain overall. I can see another important thing is the flexibility within the organization. If we can put this flexibility by moving the material from one area to another, and then managing the people from one area to another, and also changing the purpose of the building with this flexibility, it makes the operation efficient and we can help to more people. And I can see lots of countries, they were not able to manage this one, and then they have failed. I have visited lots of hospitals in Cairo. If you go to there, you will see some people sitting in their offices. In the office, you will see a bedhead unit just behind them. Why? Because those hospitals in earlier years, it has been managed and planned in a way with this flexibility that you can utilize every single room as a patient room. And if we look at these old hospitals, old people's mindset, they were there. But now we don't have this one. And if you ask me about the Greenfield Hospital changes, what we will see in coming new hospitals, I mean, as the group today, we have one construction going on in Medina, and we have 100 hospitals in Jeddah, and we are just starting the new construction in Mecca. We just acquired a new hospital in Abu Dhabi. So lots of constructions are happening around. So what I see, flexibility in the hospital design is going to be an important point. We have to have flexible HVAC systems, which will allow us to change the purpose of the rooms from the ICU to the normal room, and then the pressure management and the other things. It's going to be very important. Command control centers is going to be very important. As Dr. Azad said, today it is the time to manage lots of patients from one center by using the data as well as the eICU systems. We will see lots of new applications coming in that we can manage lots of patients, not from, I mean, just in one city with multi-sites. From different countries, we can manage lots of patients together and manage the cost as well. Another important thing, what we are seeing now, Vivek, is the isolation of the building itself. If we look at the old designs, we have built the hospitals on one, core design. In this core design, there was one entrance and then one service at all within this hospital. And we have seen the disadvantage of this now. What happened since the elective surgery, elective services has been stopped. So then we have only one entrance. We only have to, we're able to use this entrance for the COVID patients. If we had two towers, one tower was able to manage the COVID patients, which is now going to decrease the numbers, and the other tower immediately can be utilized, isolated for the other patients. And I'm glad, FUH has this function, and then from now on, we will manage all our hospitals in this front. Another important thing, what we have observed within this period, ambulatory care within the hospital, diagnostic care within the hospital should have an access to the street. Why? Because people, they don't want to come to the hospital for the ambulatory care and the diagnostic services because of their fear that the hospital has a contamination inside. But if we can give the access to the people that you can have your MRI, CT by not getting into the hospital from outside, the direct access, you can get into the hospital and you can get this service easily, then this will help us. Because the thing what we are seeing now, yesterday we had a long workshop, we are just discussing what is the new waiting room in the hospitals. The waiting room concept is going to change dramatically. Why? Because the portion of the patients from now on will require the telehealth, and the portion will require the physical visits. So then we have to change the waiting room setup from there. Doctors, they may need a video call room instead of just the patient room, the clinic over there. So we are bringing a new setup over there, and we are also discussing this with our technology partners. Just last point, if I may touch, we need another point, which is the online and offline integration. What is this? Today, we have seen that clearly we were not able to help all our patients in our hospital. We tend to manage a portion of our patients in either hotels or at home or in the other areas. Today, we need the online and offline integration together, where we can manage with the same systems in our hospital, within our eICU system, we have to connect with the patient at home. So at the moment we are working with Cisco, and then we are going to have this system in our hospital ready where the similar item can be installed at home, and we can just connect it, and we can continue monitoring this. And as Dr. Azad has also touched to the point, the home healthcare is going to be very important, which we believe there will be more and more services to be extended from the home healthcare arm. And then we will see more investments in this one. And then we have to extend the services to the other areas. Thank you very much.